everybody, and welcome back to what is the final episode of nursing surgery. I, your nurse Haiqal, for the final time, will be explaining to you about today's topic, which is the warning signs of cancer on our patients. Now, to understand the warning signs of cancer, we need to know what is cancer in the first place, ladies and gentlemen. Well, cancer is known to be a disease in which some of the body's cells that we have trillions of cells in the human body, they can grow uncontrollably without any control. And because of this uncontrolled growth, those cells would spread towards other parts of the body. Essentially, the cells start to grow uncontrollably, and then a mass would form. This mass inside our body would be called a tumor. So the tumors are separated into two, which is a malignant tumor or a benign tumor. A malignant tumor is a lethal tumor. It's the type of tumor that you should be very worried about. Not to say that a benign tumor is not worrying, but it is less lethal or not even lethal compared to a malignant tumor. Now that we understand what cancer is on a very general basis, we shall now look at the warning signs. Knock, knock, knock. Hello, miss. My name is Haiqal, and I am your nursing assistant for today. I was told to gather some information about you, such as signs and symptoms. Would that be comfortable with you?
Yes.
Alright then. There are a few questions that I will ask, and if you do not want to answer any of them, it is completely fine. Just tell me I'm not comfortable with sharing that information. But if you are, it would be greatly appreciative for us to help you get you better healthcare. Alright?
Okay.
So, first and foremost, have you had any unexpected weight loss unintentionally?
Yes.
Alright then. Have you had a persistent cough that doesn't seem to go away even though you tried over-the-counter medicines?
Yes.
Okay. Have you had any difficulty in swallowing food? Not as in you choked on food, but when you're swallowing the food, it feels very painful.
Yes.
Alright. There are not many questions left. Have you had a mole that you realize on your body that has changed in size or color?
Oh, yeah.
Alright then. And I realized you've had a sore throat. Have you had it for a long time?
Yeah, quite long.
Around 2 months maybe?
3.
3 months. Very well then. This is the last question, miss, and thank you so much for cooperating so far. Have you had any change in your bowel movements or bladder activity?
Yes.
Have you been constipated or do you have diarrhea?
Constipated.
Constipated. Almost every day?
Yes.
Alright then. Last but not least, if you have realized, and I don't expect you to know, have you had blood in your stool?
Oh, yes.
Alright, there is also presence of blood in your stool. Thank you so much, miss. Those are all of the questions, and I am greatly appreciative of your cooperation. Thank you. So, ladies and gentlemen, those were the warning signs of cancer present in our patient. There were 6 warning signs that I gave to you just now. However, when you have about 3 or 4 out of the 6, that is when you immediately rush to the nurse and tell her about your findings. Now remember to share, like, and subscribe if this video was informational, and there are no more episodes. So, goodbye.